My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. Today, I've got the great pleasure of being joined by Dr. Marissa Theophanides. Marissa, introduce yourself to the audience.
Hi, everybody. Yes, so my name is Marissa Theophanides. I'm a urologist in the Bronx, currently working at Montefiore Einstein. And yeah, I'm really excited to be here today to chat with you about a topic I'm very passionate about.
Yeah, so I had the great pleasure of meeting Marissa through kind of a faculty retreat and things that were going on there. But then she came and spoke to us about effective communication. So vital to what we do, so important. And like many things on this podcast, not addressed probably with the full attention that it deserves. So talk to us a little bit about effective communication, just kind of big broad strokes. Why is it so important for doctors?
Well, I think you can't, obviously all healthcare occurs in the context of relationships and how we communicate. Like the whole thing just doesn't function unless that's happening. Whether it's talking to patients, talking to people you work with, like how institutions communicate with the communities they serve. It's pretty much, I think, the glue of like what holds healthcare together. And a big part, and I'm sure many folks in medicine, when you a little kid, if that's when you first started thinking about it, like when I did, like the idea of connecting with people and helping people was like the real draw to the field of healthcare. And I think that focusing on that and bringing healthcare back to good relationships and good communication is key to getting back to the essence of what it is.
Yeah. And I'll go back to med school for a second. I'm trying to remember my med schooling, which was longer ago than I want to admit to. But, I remember fourth year we had, or actually probably preclinical years, we had some kind of introduction to actors who were patients and some kind of supervised conversations with a little bit of feedback. As we progress through, we get some observed kind of patient interactions with a little bit of feedback. It felt more like checking the boxes than effective communication teaching. What was your experience like through training?
Mine was very similar. I mean, we had courses, and I have to say that there was a woman who I think she's moved up in the chain, but she taught a class for us. Her name was Luba Konopasek, and I won't forget because a lot of my colleagues had a very eye-rolling reaction to these classes about the touchy-feely aspects of medicine. But she did such a good job of actually introducing the concepts and sort of weaving it into our curriculum. But I do agree, it's one of these things where when ACGME is involved, it's like it almost feels like a little like checkboxy part that we have to kind of go through and doesn't become. I think it's something that needs to be just more of your everyday and just part of what you do, and less a specific task or educational task that you have to complete. But I think med schools are getting better now as well, and residencies as well, as a testament to what you guys have going on and the excellent curriculum you guys have developed for the professional development. I think that it's something that's becoming more forefront, and I think that we're making progress, but we're not 100% there yet.
So let's get into it a little bit. Let's get into pitfalls. What are some of the big pitfalls you see with effective communication? And I'm going to lead in by saying, one of the big take homes I got when you spoke to us, and this has been said in multiple times, but it really resonated the way you spoke, is because I never thought of it in a medical context before, but all communication is about what are you trying to say and what is the other person receiving, hearing, or taking in.
Yeah.
And I never really thought of medical communication that way in that context. So that was a pitfall for me. And I think just framing that a little different helped me immediately once I walked away from your kind of approach. But tell us, what are some of the big pitfalls we see where people fall short?
Well, I think it's several places, and I think that part of it is not on us as as clinicians, but because I think we're put in a system that is not conducive to natural communication that we would have. Like, let's say you and I just like hanging out and like getting to know each other. Like, we're under a lot of time constraints, and if you're not out there, whoever you are, wonderful. I'm very jealous, but everybody's very busy. And whether it's at work and at home and people's minds are in a million different places at once, I think that can really fracture the communication and the relationship aspect of this. So I think one major pitfall is, I think that folks really get into this pattern of assumptions, which is a big thing. And I don't think we talked about this much when I spoke with you guys, but we get into patterns when we see a specific diagnosis. We start talking to we dive into an HPI and start getting information. We're kind of just going through the motions. And I think we really miss out on a lot of what is really going on in terms of the patient's expectations, the patient's, personal story. Like, are we even meeting that patient where they are in terms of understanding? So I think it's very easy for us to get into these sort of rote cycles that we've just conditioned ourselves with just for the sake of getting through a visit in 10-15 minutes. And I think that's the biggest pitfall. And I don't think it's anybody's fault. Everybody wants to be nice and have a good like a good connection with people, but I do think the system puts some constraints that forces people into these kind of habits that just get kind of reinforced over time.
Yeah. And I was going to try and wait till later in the podcast to get into the kind of mindfulness spin, but we're there
Yeah.
already, right? I mean,
Yeah.
this talks about being present and being present with not just our patients, but that specific patient in that specific moment.
Yeah. And I think that this is, well, I mean, I'm very into the mindfulness, obviously, and with my yoga background and everything else, this is a huge part of, I think that much of the communication and our interactions and all this, really a big focus has to be on working on ourselves, and how we treat ourselves, how we give ourselves space, how we stay present. And what I think is interesting about this, there was a great book in terms of the aspect of how we're communicating and where mindfulness comes into that. There's a book called The Charisma Myth by a woman, Fox Kavan, I think is the name. And this idea that some people are just good at communicating and are very charismatic, and the fact is that it's actually a skill that you can sort of learn, and you can actually become a very good relationship builder and communicator. And a big part of it, and three things that she brings up, one of them is being present. And within like seconds, a person can tell whether or not you're present, right? So if you're not there 100%, it can really change the dynamic of the interaction. And that's just something I think it's so key. And I know it's hard as a mom and all these things, like sometimes you're in that trap of like, okay, like, is clinic going to finish in time before like camp lets out and all these things. But if you get into that mode, people pick up on that. And it's really, it's those sort of subconscious cues that we're sending out when we're not present that, people really do, pick up on.
Yeah, I think it's an incredibly powerful and strong point. We all see this, and we've all done it, and we've all had it done to us.
Mm-hmm.
When you're having a conversation with somebody who's really into what you're saying, and they make you feel like the center of the universe, and that's
Yeah.
incredible. And
Yeah.
in a medical setting, when you're scared about, it doesn't matter what it is, in my world, cancer, somebody else's world, a benign process, something that's really affecting quality of life. When you're really in the moment with that person, they know it and they feel it and they really appreciate it.
Yeah. And I think when you give somebody 100% of your time, and this goes into the 100% of your focus, this goes into that whole, time trap and the stress of, moving through a clinic or, getting through rounds or whatever it is, you ultimately will spend less time when when somebody feels like they're giving you, that you're giving them your full focus. It's going to be, people are going to keep talking, and they're going to keep trying to get you to be in it with them. So if people don't feel like you're listening, or they're not getting their point across, they're going to keep repeating or finding ways to try and engage you until they feel like they've done that. And it's remarkable when you really stay present and you tune in to meeting the patient where they are, how efficient and quickly it actually can be.
Yeah. And I found this an extremely easy skill to teach. And particularly, med students will come around in clinic, and it's become one of the more common things I point out. And I say, hey, listen, you're doing a great job of listening, but you interject a lot. Next time you have a patient interact, just try not interjecting. Just let them finish their thoughts or their sentence. See how that feels, and see how the tenor in the room changes. And I'll tell you what else that's done is made me realize when I interject.
Yeah.
And by pointing it out and helping, just being, once again, mindful or thoughtful of these processes, it is a skill. And being able to listen with your mouth shut and your mind open is not so easy.
It's not. And the data suggests that we're really bad at it, right? It's like seconds before we start to like interject with people. And conversely to that is that people don't talk forever. Like the data suggests that it's about like 90 seconds, which is, when you try and talk for 90 seconds on your own about whatever it is that you want to talk about with the uninterrupted, it actually feels like a very long time. So I don't think many people are actually going that far. So I think being really mindful of that and how we listen. And I think that sometimes people interject in an effort to maybe try and establish a connection or to show that their knowledge or their skill. But in reality, quiet listening and active listening does a better job at that than what we've kind of reflexively do.
Yeah. The two skills I've learned from mindfulness training that have really helped me with patient communication. The first is, just as I said, just being quiet and just paying attention to people. And the other one is reflecting back. Sometimes say, hey, I'm picking up this. I'm picking up sadness. I'm picking up worry. I'm picking up whatever it may be. Is this accurate? And you can even do it with factual information. Oh, I heard your CT scan was on this date, and reflecting that back. And that gives, I think, more of a meaningful interaction with patients, and has really been helpful.
Well, I think, and the reflecting back and the naming of the emotion, which is the one thing you brought up, which I think is huge. And I think that if you walk away with one skill, it is that, like being able to, and sometimes it can get you into trouble. Like if you're not good at reading emotions and you're like, you seem angry, you're like, I'm not angry, like, and it's fear or something else. But as you start to feel more confident about being able to pick up on those things, it is, I think, the number one skill in terms of being able to deal with any kind of difficult interaction. And, talking about dealing with, maybe angry patients, or a difficult, an argument that you're having with another staff member about something, whatever in your personal life, being able to identify it, B, name it out loud so the person knows that you're actually on the same page as them, is like an immediate diffuser of, any kind of issue that's going on. And if somebody's sad or upset or nervous, it really makes them feel like you're there with them. And I think that's huge. And that's one skill that, if like you're going to do anything, I think that's huge. And the reflecting back too, there's the whole concept of mirroring is another huge part of, I think, sort of rapid rapport building, which is critical in like this time crunched environment that we practice in. I don't know if you've ever read Never Split the Difference by Chris Voss. It's a book on negotiating, nothing to do at all with like medical communication, but so many amazing pearls for like life communication. It's actually fascinating. He's a hostage negotiator. And the whole book is, how to create this rapport so that you could, negotiate hostage situations, but they translate over amazing to business and personal, aspects of communication as well. And one of the primary skills he discusses is this whole concept of mirroring. So when, the last couple of words that somebody says in their sentence, just repeating those back can, subconsciously create that immediate rapport, which will be helpful in terms of, moving things forward and also, connecting with the people that you're talking with.
I'll diverge for a second. I have not read that book, but my favorite communication book is I'm looking right at it. Crucial Conversations.
Mm,
Crucial Conversations is a really good one. If you haven't read it, it's been updated a bunch of times now. Super helpful with every communication aspect you have in your personal life, in your private life, at work, with patients. Really good about, once again, kind of effectively communicating, building rapport, making sure your message is sent and received. So I'll
yeah.
just throw that out there. But let's get into some of these skills. We talked
Yeah.
about rapid rapport building. We talked about active listening and reflection. What are some of the skills, and how can people work on these things? And I just want to say, sorry, before we get into that, where we talked about calling out emotions, and you mentioned that you may not be good at this. You may not be good at this, and it can be a real challenge. But the way to get better is to
Is
try.
to do it. Yes,
Yes.
absolutely.
And even if
Like,
you get it wrong, like you
yep.
said, oh, you seem really angry. No, 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 I'm more frustrated. You're still building rapport with that patient because they're recognizing that you're trying to acknowledge who they are.
Yes. Yeah. Absolutely. I think you can't be afraid to just try and throw it out there.
Yeah.
And over time, some people are just so naturally empathic and, that's great. And they can pick up on those things. But for some, it's a challenge. And I think that just like you said, just doing it is an amazing way to just build that skill. And there's endless opportunities in our day-to-day interactions to do that.
Yeah, absolutely. All right. Sorry, I side railed it for a second. Skills. What are some of the skills we can work on? What are some of the things that you teach and you like to work on with residents, trainees, whoever it may be, faculty?
Yeah. So, I mean, I think it's you can kind of break it down into like three steps, let's say. I am under the training of the American Academy of Healthcare Communication, and that's a program that we're working to sort of start implementing here at Montefiore specifically to work on our communication skills and how our patient experience and so yes, in terms of the specific skills that that I kind of try and instill or try and work on for myself to make things more efficient and also to improve the patient experience as well as my own, fall under the teachings of the Academy of Communication and Healthcare, which is a program that we are implementing here at Montefiore in the coming year. And basically, it breaks it down into three steps. So, kind of how we open the interview and negotiate how we're going to interact with patients, and then really exploring the patient story, which is huge in terms of how we meet patients where they are, and then how we close out our visits to make sure that patients really understood us, right? And I think that these are all things that we kind of take for granted at times and don't necessarily focus on, but they are very, very small tweaks that can actually make a huge difference in how patients perceive our interactions. So in terms of the first step of it, it's really like how we create the rapport. So like I mentioned, just like how you greet people. And, I think one thing that I was taught that I think that I never really did, overtly, but with such a small gesture, like just asking somebody if they're comfortable. And it's such a quick, easy thing to do. Like, are you, it feels a little chilly in here. Are you okay? Or like when we see our kidney stone patients and they're like just doubled over on the exam table, like, oh, you look very uncomfortable. Like, what can I do to make you feel more comfortable? And that may mean like lying on the exam table throughout the entire visit, but having putting that out there for somebody to take advantage of immediately sets a great tone, and that's something that I now do with every patient visit, and it is very well received. And another thing is, and not everybody is good at this, and I think this is also just a practice thing, just like the small talk before the big conversations, right? So whatever it may be, one thing is a big joke around here is the parking in the Bronx. And almost everybody has like a little parking or logistical story in terms of, getting to clinic or whatever it is. And even something as benign as the weather. I love pointing out things in people's outfits, school shoes, school shirts, like just something to kind of, set the tone and make people feel comfortable. And one thing that I think is not something that I always did that I found really helpful now is kind of just setting expectations in terms of what our time limitations are. If you're on call and you think that the hospitals or the OR or somebody's going to be calling you, like let people know that like that might happen. So then the interruptions when they happen feel less intrusive. And these are all like very little things that don't take more than a nanosecond on your part to just be able to kind of set a stage for a good relationship moving forward in a very sort of quick way.
Yeah, we talked about this a little bit when you visited our group, but I always find myself doing the small talk at the end of the conversation, and I think that's a little bit specific to the cancer practice. I just, a lot of times you'll see the anxiety on people's faces, and they just want to get the business out of the way. So we jump into the business, and it's, I'm really sorry you're here to talk about cancer or a suspicion of cancer or whatever it may be. And then at the end, it's all right. Well, what do you do? What's your family do? What do you like doing? When you're not talking about cancer, whatever it may be.
Yeah.
And I know it's not the way you teach it, but I found that to be incredibly valuable in building rapport, especially in somebody who very often you're going to end up operating on.
Yeah, I think in certain, obviously, like the timing and where you do these skills and all of that. Like, I don't think when you do it is just as important as just doing it, right? So like I agree, like if somebody's coming in and they've got their stack of papers with their pathology report or whatever it is, like it's hard to be like, hey, like did you catch the Phillies game last night? Like people are just they're not ready for that. And I think once you've created a space where you can actually diffuse some of that energy. And I think people still will walk away with that feeling of comfort and collaboration, even if it's done at the end. It doesn't matter. You've done it. And like that relationship is being built.
Yeah. And I learned that, especially to John Gerhardt, who was one of the peds urologists at Hopkins where I trained. Patients would come back for their annual visits for years and not really have anything medical to go over. And he'd get the medical stuff over in about 10 seconds. And then he always remembered their family or whatever it was, summer camp, whatever was going on in that kid's life, where they were thinking about now going to college, even though he operated on them 13 years ago or whatever it may be.
Yeah.
And people loved him for that. Yeah, his medicine and surgery were great, but people loved him for that. And I think it's a great way to build relationships too. So especially when you have the shorter conversation, deliver the CT scan and the results. Hey, cancer-free, you're good. But then sit there and just spend a few minutes. There's nothing more offensive than just delivering news and then walking away.
Leaving. Yeah. And I feel like we're so, it's so easy now too, to just make little sticky notes. That, the other day I had somebody who I knew that just like loved swimming, and like it literally was a sticky note on my thing that just said like, big time swimmer. And, and that was, I had very little to say in terms of, oh, wow, like your surveillance sono looks great. But like, it's summertime. Like what, you've been swimming indoors, outdoors, like, how's that going? And like, she lit up. Right. So I think it's just those little things that, can make such a huge difference.
Yeah, that's a good one. David Keynes talks about the sticky notes a lot in one of his epic hacks. I've gotten a little bit more into them. I used to just put all that information right in the note. And for some people, now that everything's released and they read all of their notes, oh, he or she was really listening to me. They picked up the fact that I'm an engineer and my daughter's into this and whatever it may be. And some things are less appropriate for the medical record, and those are the ones I put in the sticky note. But if it has anything at all pertinent, I put it right in their notes too, because they're gonna a lot of people will read it and actually see what you wrote and thought about them.
Yeah, it's a different world in terms of access to the actual notes themselves. And I think it can go both ways, I think in terms of some people may not want certain things, but I think, like you said, it actually is a way to show that you were in fact listening.
Yeah. All right. So now we talked about setting the agenda. This is setting our intention in a mindfulness perspective, right? We've 100%. Set an intention. Yep. What's our goal with the patients? What do we want to achieve together? All right. Next step, creating space.
Yep. So, I mean, the creating of the space is also just so much goes into that, right? Like now that we have computers and you gotta get everything into the Epic at the same time, and you're, typing away and all these things. I think you just have to, again, going back to being mindful about how you're set up, right? And that's the space creating. Like you don't want to have a computer or in between you and a patient, or your back to a patient at any point. Like all these things, the body language of that is just so closed off, and is going to really, work against you if you're trying to establish a relationship with somebody. I think a big challenge, it's very easy to move a chair or move a computer out of the way. I think a big challenge is when we're using interpretive services, which is something that's very common here. Thankfully, like I speak Spanish, and a big part of my patient population is Spanish speaking. But if I really feel for my colleagues who don't speak Spanish when I have to use an interpreter for Creole or Mandarin or something else, because it can be really challenging to navigate those conversations and still maintain the essence of that, like, I am here with you, and like, we're doing this together, and create the same kind of rapport. But it can be done, and I think that we have to really sort of hunker down on how we're using those services when we do. I think making sure that you're speaking in short sentences and speaking exactly as though you would if you were speaking in English to somebody, and always looking at the patient and not at the computer or the phone, whatever kind of device you're using. Because it can be, I think a lot of times patients, when they're, don't speak your language, can already feel a little bit marginalized by the system, right, in many ways. And the data would suggest that those are actually, that's real. People do feel like they're not getting necessarily the same care. So I think how we interplay with that is also really important to consider. And also gauging, how people, like, where people are at in terms of their health literacy and all of that. So you're actually tailoring your conversation to a level where people are going to be able to take in that information you're trying to convey.
That's great. And I think, once again, this is the presence part of the mindfulness interaction, setting up the space, setting up your physical space so that you can be more present with someone. There's less distractions and interactions, and set things up in your favor, right? Don't struggle against construction noises and a busy, office. Put yourself in a quiet space where you can have the proper interaction with a patient. Otherwise, you are setting both of yourselves up for failure.
Yeah, 100%.
All right. And then the last part in your kind of 3-part frame is assessing understanding and kind of bringing home the message. So what are some of the skills you talk about there, and how can we better do that part?
Yeah, well, I think that, before you even close the visit, I think in terms of like one big piece too that I want to make sure we talk about is like how we sort of explore where our patients are, right? So I think that you can't meet somebody where they are unless you know where they are. And I think that, how we, going back to the assumptions and how we kind of put, certain diagnoses and patient populations and categories, it's so important to kind of get the patient's story in terms of why they're there and what is going on with them. And I think that, and that's something as easy as an open-ended question. Like, I think patients really are, and I think we're trained, we have so much training, and we think we're the experts at everything. And we are, to a degree, experts in certain, parts of our fields. But patients really are the experts in their experience, right? So it's like, they know how they feel. They may have ideas about what's causing their symptoms that we would have never thought about, or fears that we would have never thought about nor addressed if we didn't, try and delve into that aspect of it. And a very simple thing is just to ask them, like, what do you think, like, why do you think this is happening? Or what do you think is causing XYZ symptom? And you may be really surprised to see what comes out in terms of, let's say, like, oh, I don't know, like, uncle had prostate cancer, and he had the same urinary symptom, and it's something that wouldn't have necessarily come out in an interview. And you can address that fear and kind of make sure that you're addressing all the things and meeting the patient's expectations that you may have not otherwise even known to do. And I think that's huge, as understanding that people come with their own ideas and expectations, and we have to make sure we understand them before we get into the nitty-gritty clinical stuff that we want to get out of a conversation.
That's such an important message. I want to highlight it right away now, and then highlight it again at the end. Is patients are expert in their experience, right? They know what's going on with them, and we can certainly try and give them a scientific understanding of that, but we don't know who they are at their deepest core, and we can work to expand that.
I think that's huge too, when you're trying to help people make changes, right? Like healthy changes and all of that. And there's like a whole if you're into the idea of like motivational interviewing, which is another whole, you have to know where people are and why, what their why is, or what their motivations are, to be able to help them, right? And I think that they're very easy. It's a very easy bit of information to get from people. It's just a matter of making sure you're asking.
It's great. Super powerful and really simple stuff that
Yeah.
it goes over our heads a lot. And we get so wrapped up in our days and what we're doing that we forget sometimes just to ask these little simple questions.
Yeah.
All right. So now we've asked questions. We've created space, set an agenda. Are we ready to assess understanding yet, or where are we?
Yeah, I think that I know for me, for so many years, I was so guilty of the whole spiel thing where it's like, okay, you have a kidney stone. Let me, for like, in these 2 minutes, I'm going to tell you everything you need to know about your kidney stone and like what the surgery is going to be. Like, these are all the different surgeries. And like, okay, thanks for listening. Now, what procedure do you want? You know? And it's like, it's become almost like, when I think back to how I was interacting with people, it's almost crazy to me that like I was doing that. And I feel so, I wish there were so many things I could go and take back in terms of like, you know, the deer in headlights that I didn't necessarily pick up. And, you know, patients they don't want to make you feel like you're not doing a good job. So very rarely, if you ask them, like, do you have any questions? They'll often say no, just because they don't want to, you know, sort of disappoint you in many scenarios. And you know, not that your explanation, they don't want you to think that your explanation was bad or whatever it is. All the data suggests that people will not ask, or they will not, you know, continue to go down the asking pathway. And I think that the idea of sort of breaking things down and making sure people understand what you're getting, and it's a very easy thing to do, but it's not something I was ever doing. So I think it's a really important way to end a visit in terms of making sure that they're getting all the salient things out of the conversation, and that you feel confident that the patient's going to walk away and it's going to be you know, a safe outcome, or the outcome that, you know, you both desire. And that's something that is pretty easy. And it's actually, nurses do such a good job of this. At some point in their curriculum, they just get this training, and it really is effective. And it's just the whole concept of like the teach back, like, okay, I've told you a bunch of things, like, can you just tell me in your words, or what are you going to tell your spouse later, just to assess that they actually got the points you're trying to get across. Again, something just takes 10 seconds, and it's so easy, and it'll give you right there, either you completely bombed it and they have no idea what you're talking about, or, you know, the last thing you want is somebody to come back after you had like a, you know, 20-minute conversation on active surveillance, and they come back, you know, in 3 months or whatever, and you're like, wait, I have prostate cancer, you know? And it's like, it's such an easy way to make sure that, like you said, you sent a message, was it received, how it was received. And that's such a quick hack. It's so easy. And I think, you know, personalizing it, like, oh, what are you going to tell your significant other, is such a way for people to conceptualize it and break it down in a way that's going to be quick too, right? Because they're just going to tell you how they would tell their partner, right? It's not going to be a long-winded thing, but you'll be able to make sure that everything got across.
Yeah, I was guilty, and still am guilty, of the spiel and kind of the prescriptive kind of ending to conversations, which has its merits at times. But after listening to you and being a little more open-ended in some of the conversation, I build in now pauses and say, okay, now's a great time for a pause. Like, where are we now? Then, all right, I'm going to continue. And then where are we now? And it's helped me kind of meet a middle ground of making sure I'm getting information out. And the teach back, I think, has been really valuable. I tend to use we use Epic. So we have after visit summaries, and I tend to use the after visit summary a lot for the next steps.
Yeah.
And now if I do a teach back, be like, okay, tell me what we're doing next. All right, you're right. I have active surveillance. I'm coming back in 6 months in a PSA, and I'm going to get an MRI in a year. And then I'm like, great, like a magic trick. I give them the after visit summary that says, exactly the exact same thing. So they have it, that too, written down. And if they don't get the teach back, then I have the ability to kind of show them on their after visit summary where they can find it written down too. But that little interaction, it's the same thing. They get the same piece of paper with the same writing on it, but it's made it a much more powerful interaction. So I appreciate that guidance from you.
Yeah, I think also that what you brought up about the sort of checking in, right? So like how we break information down, like people can't handle it all at once. Like it just doesn't sink in. And I think that sort of breaking it down into little chunks, and we talked a little bit about what I think is a very powerful tool that the ACH has been learning from them, is the whole idea of this ARC loop, where you like asking a question and responding to their to whatever the feedback is. Like when you said you're checking in to see if they get it, and then if you have to interject more information, you tell them what you need to tell them, and you just repeat this cycle until you feel like everything is out out on the table. And I think it's a really good way of kind of assessing that knowledge in real time, and also little moments of being able to kind of build even more rapport with your patient.
And the last component of mindfulness is obviously being non-judgmental. And I think that's where it really kind of ties into this. Is we're not passing judgment on how they're interpreting things or what they're taking home. We're just trying to make sure they get the message. And so
Yeah.
keeping that kind of open mind, saying, it's not, listen, they don't have they definitely don't have a medical education. They may not have a college or high school education. How do we make sure in a non-judgmental way that they're understanding what they need to understand for a good outcome?
Yeah. I think that and when it's done in this sort of fluid way too, like people don't feel like they're getting a test. Like it's just more like, it's like, oh yeah, like I always say that I want to make sure I did a good job. And that I think also sort of diffuses the pressure that like they have to, that this is some kind of a quiz. And I always start with, I want to make sure I did a good job of explaining this. So why don't you tell me X, Y, Z? So it kind of, the onus is on me to give the information because I'm the expert at whatever it is we're talking about. And it's not on them, it's on me, and which I think is another nice way of kind of diffusing some of that fear or anxiety that patients might have, especially when they're already overwhelmed by whatever the diagnosis is, right? So I think you finish on a high note.
One of the other things I picked up from you is the what else ending
Yeah.
to the conversation. So tell the audience what else means and how you use that powerfully at the end of your
Well, I think it's
interaction.
just all about, it's again, open-ended questions, right? So, it's for the same reason that patients won't, they'll pretend that they understood what you said, right? If you ask them, what do you have any more questions? Often they feel pressured to say no. Sometimes you have people who do, and they will say, oh, actually, yes, I have one more. But I think you want to be very mindful that that's an open-ended question. And by just asking what else, you're keeping it open, so that people can, continue to get everything out on the table. And once people feel that all of their concerns are heard, you'll be able to keep moving forward. And you kind of touched on this before, is that if somebody has something on their mind, something that's nagging, or they feel like they're not getting their point across, they're going to keep talking until they feel like they've been heard, right? And this is a very nice way of just making sure everything's been out there in a very effective and efficient way. And patients feel better too. Listen, you're not going to be able to, I mean, I'm not an expert at a lot of things. I'm not going to be able to address every concern that a patient has, but at least I can open up a conversation of how I can help them get the help they need for that problem. I mean, how often are you rounding and they're like, oh, yes, I feel better, but I don't know, I was supposed to have the no dairy tray today for lunch and whatever, and it starts to, but it's very easy to be like, oh, like, is there anything else bothering you? And that's it. Okay, no problem. I'll make sure that the order is correct, or we'll talk to nutrition or whatever it is. And that patient's going to feel, so much better at the end of that interaction. So sometimes it'll be stuff that you really can't help with, but just getting it out there and making sure people feel heard is a huge part.
Yeah. Well, I want to switch gears a little bit.
Yeah.
Let's get into difficult conversations. How about tough stuff? What's your advice and how do you teach people how to have tough conversations?
Yeah, I think the first step is you have to check your own emotion. I think that's huge. And I think that, you you don't want to be having a conversation when you're all flustered and all of that. And sometimes you're not gonna be in a position where you can step away and you know, really like take a moment. Like you might be in a very like acute situation where it's heated. But recognizing how you're feeling and trying to, I think for me, a skill that I use is noting. It's like a just kind of like naming it what it is, which kind of takes away like a little bit of the sting of it. Like, okay, like XYZ patient is, let's say, somebody who's being like combative, right? It's actually like a scary, like physical situation. Like for me, it would be like, okay, I'm scared right now. Like just this is what this is like, and that kind of helps diffuse it for yourself. And then going back to in terms of naming emotions, like we talked earlier, like getting at what is going on with that patient, and getting it out there and naming it. I have yet to come to a situation where that has not like taken it down at least a couple points. It's not a miracle, and you're not gonna like suddenly the skies aren't gonna part and like the rainbows aren't gonna come out necessarily all the time, but at least it diffuses it enough where you can start the dialogue. And I think sometimes people just want they want to be recognized for what they're feeling. So I think that's the biggest thing. And this is not just for like, difficult or scary patient, interactions. This can be just an argument you have with like a spouse or whomever. It's just, getting the emotions out there on the table, and allowing those things to be diffused is going to make for a more effective conversation to follow for sure.
Yeah, and I would say, two quick plugs. I mean, this is where formal mindfulness training can really be helpful by understanding what you are experiencing at the moment can prevent you from falling into some pitfalls or escalating something that doesn't need to be escalating. And
Right.
how many times have we seen these interactions where two people's escalating energy just feeds off each other because they don't
Yeah,
even realize kind of the death spiral they're putting themselves in, right?
absolutely. Yeah. And that's huge. And I think that, so much of this and the whole communication thing, like I said in the beginning, is really just about like knowing yourself, being present, and being mindful, right? And that's it's hard to do in some moments, but I think that if we try and create those pauses, before, and you can apply this to so many things, like it can be a nanosecond just in your own mind, but taking those pauses to really see where you're at and evaluate what's going on with you before you sort of step in and add to the energy is huge. And that's like a couple second thing that you can do, to make sure that you're not going to end up in that sort of death spiral of
Yeah.
emotion.
Yeah, and then where you'll do something that you regret or could irreparably damage a relationship. And
Absolutely.
and I think one of the things that's important to recognize too is that you don't have to have every conversation in the heat of the moment, right? It's also very fair to say, listen, I'm really worked up about this right now. Let's talk in half an hour. Let's talk tomorrow. Let's do
Yeah.
this. And
Yeah.
where people really fall into this is with email and electronic communication.
Yeah.
And because it's so easy to just fire back, people fire back.
Yeah.
And we've all heard this, but it's worth saying. Like when you have a fiery interaction electronically, I tell my mentees, mentor, whatever you want to say it, write your response now. That's okay. Don't send it till the morning. Edit it, and
That's
you're going to want to edit it before you do it. But at least like you understand the emotion you felt, you understand everything you were going through, and give yourself an opportunity to reflect on it before you go ahead and put your foot in your mouth.
Oh yeah, I have a whole, I mean, I probably could clear it, should clear it out, a whole bunch of saved drafts. I think I mean, with electronics, I mean, it creates so many barriers in effective communication as it is. But yes, it's also really hard to, interpret tone, and it's just a minefield for, poor communication, unfortunately. So I completely agree. Taking that pause there is huge. But there's something also therapeutic about writing the email sometimes, and that also helps to kind of get it out. But yes, I completely agree on the do not send until the morning, because I think that's a critical piece of it. I mean, obviously in patient interactions, like it's not going to necessarily be so easy to kind of step away, but like that's also an option. I mean, there have been plenty of scenarios. It's a little bit different in clinic. Sometimes it's like, okay, I don't think we're going to be able to come to any kind of agreement here, whatever it is. like, why don't I get you set up for a follow-up appointment? You can talk XYZ over, or look over whatever research you want to do on your own, and then we can talk about it when you come back. Or if it's an inpatient, similarly, like, okay, it seems like you're really angry right now. Like, why don't I give you some time? I'll come back after lunch and we can kind of reconvene. There's ways to work it in. And I think another important point is that these are just skills to use. Like, you're not every situation is going to end up like how you hope it will, right? Like, there are going to be people who, no matter what you do or how kind or compassionate or how hard you try and meet them where they are, like, it's just not going to happen. And I think that's also part of the sort of self-compassion and like being kind to yourself and realizing, how you take care of yourself as a clinician, because it's not your fault, and it's just the way things are sometimes. And it's just, you can use these skills to create lots of beautiful interactions and great relationships, but it's not going to be 100%. And you can't put your pressure on yourself like that to expect that would be the case. And just being mindful of that as well, that like, people are people, and there are some challenging folks out there, and you have to take care of yourself as well.
Yeah, you're not going to love everyone. They're not going to love you, and that's okay.
Yeah, that's okay. Why would you want that, right? It's
Yeah,
like,
exactly.
it's not the way that it's supposed to be. And
Yeah.
it's just, I think there's a lot of perfectionist personalities in our field, that want everything to go the best way possible all the time. And I think just being really mindful that that's not always going to be the case, especially when you're dealing with different personalities. And again, these are just a set of skills and things to be mindful of, but they're not magical.
Yeah.
Yeah.
Well, good. So Marissa, this didn't happen to you overnight. You're not
No.
the guru of communication. So tell us a little bit about your personal journey. And you mentioned your yoga background and other things before. If this
Yeah.
communication weaves through with kind of your mindfulness background, feel free to tell us. Tell us how you
Yeah.
developed here.
I think that for me, like the getting into, reading a lot about effective communication and like looking into the research, and then more recently, taking the training with ACH, I think that it's a big part of sort of like my taking back the narrative of healthcare for myself. So I think that, just for like reference, I was in private practice for years after I graduated from Columbia Presbyterian, and I was told upon my departure from residency that private practice would be my first job but not my last, and that was a very true statement. I just sort of thrive off of human connection. And I found that, like, not being in a sort of an academic environment where I had residents and students and lots of teaching opportunities and in opportunities to engage with more people on a regular basis, I just wasn't super happy. And that led me over to where I am now at Monty, as my best friend Alexander Small happens to be a urologist here too, and the stars aligned in such a way that it really worked out well, and I've been very happy. But this aspect of communication specifically, as a clinical interest, is more just, I don't want to be like a pessimist in the direction I see healthcare going, but I think that we've, as a industry or whatever, we sort of created this environment that's just, it's not conducive to the sort of compassionate healthcare that I envisioned as like what I wanted to spend my life doing, right? And sort of taking a clinical and academic focus and interest in these things is kind of like my way of carving that back out of the scenarios that have been created, where the idea of a 15-minute new patient visit to me just blows my mind, right? But this is standard now for most people. Some people get less time than that. And it's like, how my curiosity in terms of how can I still be who I am, be with my authentic personality, and get what I want out of my career and my workday, and sort of focusing on these like soft skills has really been a way to kind of like take that back, right? Because I feel like at the end of the day, I don't go home tired, exhausted. Like, sometimes, yes, there are days that are tough and difficult, but I feel like all these positive interactions, and seeing that develop, and by using some of these skills has really been a way for me to kind of get the joy back out of what I'm doing. And that's kind of like how it sort of has evolved. Yeah, so I guess that's kind of my
Yeah,
story. Yeah,
that's a beautiful story. And tell us about yoga. You still do yoga?
I do. I kind of have I've spent a little bit more time doing more like endurance sports now, which is kind of my moving meditation. Just I still do a lot of meditation, but a little bit more focus on some other types of sports. I am a certified yoga teacher. I'm not currently teaching now, but yeah, it's a big part of my life, and I think it's you have to sort of weave, whether it's yoga or whatever other kind of mindful practice you do, you have to find a way to sort of weave this in, because it's tough out there. I mean, I really feel for anybody struggling in the field of medicine, especially if you have a sort of compassionate leaning. It's hard to kind of hold on to that, and I think that maintaining the mindfulness and making sure you're taking care of yourself in those ways is really important to be able to continue to have a sort of satisfying and long career.
Yeah, and people who listen to this podcast know I'm a fan of the yoga, but
Yeah.
as surgeons, as physicians, I think it's one of the best activities, physical well-being, mental and emotional well-being. Understanding who you are when you're going through tough yoga poses or whatever it may be helps you understand where you are when you're going through tough patient interactions or a difficult situation in the hospital or a
Sure.
difficult situation at home. And
Yeah.
I think there are great metaphors learned through yoga practice that help us in daily life to be more mindful and better. So once again, that's my plug for yoga.
Oh, yes. I mean, I think that some people get really caught up in terms of like the idea of yoga. And in terms of like my more recent kind of shift in terms of what my physical practice looks like, I think that it can be so many things. Like yoga is just is a concept, right? It's not like a set of movements or exercises that have to be done in a certain way, or an exact breathing practice that has to happen. It's just, it's an idea of finding that sort of union, right? Mind, body, spirit. And that can be done in so many ways. And it doesn't have to look like like, a dancer pose for somebody. Like it can be so many things. Like for some people, that could be trail running, right? And it's just finding that space to breathe and move and get into that flow state can be done in so many ways. So I think the concept of yoga and the idea behind it in that sense it's critical. I think everybody just has to sort of find that way to weave that in one way or another.
Really, really well said. I have a couple of very pointed questions, and then we'll
Yeah.
we'll get to kind of our summary and ending. You mentioned a bunch of facts. Tell us some of your favorite facts about communications. I love the 90-second one.
Oh man,
Um,
that's my favorite too. I think that I also the concept that like in 10 to 20 seconds we're already interrupting people is just so mind blowing to me. And you're like, no, like I can't be that way, right? But like, actually, it sounds like we are, and it's to me, I think that was like one of the biggest things I learned. That was like, holy mackerel, like this is not like this is something I really need to pay attention to. And the 90-second thing, like, and when you try to like practice talking for 90 seconds, it's like you feel like you're talking forever. So when you translate that over like to that fear that people are just going to go off the rails and like you're going to be stuck in clinic for 20 years, and in it's really sort of illuminating to me in terms of what our interactions are and what they can look like. So I think that's definitely my favorite.
Very cool. Very cool. And then the other really pointed question, if people are interested in becoming better communicators formally, obviously I'll give a quick plug for you. Marissa gives a phenomenal, not only didactic, but could also run kind of small groups and kind of communication sessions for people who are interested. But if people are interested in expanding their knowledge and learning or formally being trained to help
Yeah.
others, how can they do that?
I think the best is to go through ACH. They have a tremendous amount of resources in terms of courses you can take, small group training sessions, conferences. You can read a bazillion papers that they have on the website. And then if your institution is interested, there are a variety of programs that can be implemented to kind of do this on a more institutional level, like what's happening here at Monty currently. And that's kind of been a big springboard for me in my other reading and research and other things I'm looking into in terms of like how we can be better communicators, specifically in urology. So yes, I think that'd be like my big plug in terms of anybody. You don't have to be a member. You can access those resources and take any of those formal trainings at any point. I think
and I'll put the ACH website on the notes, so people who are accessing the podcast can find that pretty easily. If you don't mind, Marissa, just tell us real quick, broad strokes, what's going on at Montefiore? What's kind of the institutional implementation of effective communication? What's going on now?
I think that Montefiore, and this is really a plug for one of the best chairmen out there, Mark Schoenberg, has really created a culture of, I think, really effective and open communication. And I think that we function very much as a small family as a result of that. And I don't think this is anything very specific in terms of specific things that we do, but as you could see with our faculty retreat and things like that, we've really spent a lot of time focusing on identifying potential weaknesses and how we can kind of grow and understand each other better. And I think that is a culture I'm very proud to be a part of.
Very cool. Very cool. Well, we're getting to that part of the podcast. Is there anything we missed? Anything you want to go over, talk about? The floor is yours, or ask questions, whatever you may have.
Oh gosh.
And if you don't, it's okay too.
I don't know. I feel like there's like so many nuances to just communicating, right? That like I feel like you could just chat about it all day and always, there's just so many aspects to this and so many different skills from so many, like ACH is great, but there are so many different schools of thought in terms of, personal communication and other skills that, I would love to have opportunities to talk about, but it's, I think that I just want to drive home the point about how this can make your life better, right? And I think that's a huge, yes, we want to make sure that the patient experience is great. And we want everybody to have great health outcomes. That's why we're here. But such a huge component of this is like maintaining the joy in medicine. And I just want to make sure that because I remember so many eye rolls back at the, in school when you're like, why are we getting a class on just being a normal interactive human, right? But we take for granted that not everybody is, and sometimes people who think they aren't, right? And I always get a little self-conscious in giving these talks or, talking about this with colleagues, because I do think people start to think this is not a waste of time, but maybe people just come with the assumptions they already know how to communicate because they've gotten to these points in their lives. And I just want people to keep an open mind that this is small, easy changes that can just do such a good job of opening your heart in the clinical space. And sort of, bringing some of that, empathic and compassionate part of healthcare back into your everyday, when sometimes it can feel a little bit hectic and crazy and institutional, and it doesn't have to be that way.
Wow. Really, really incredible and well said, Marissa. I want to thank you for spending time. This has really been a ton of fun. And yeah, you're coming back on the podcast as long as we can find some time. I learned a ton. This is a fun conversation. I think this is things that people really can work on. So maybe you and I can set up maybe a little more pointed, almost like workshop-y kind of thing, where we can go through some of the practical skills that people can work on. I think there's a lot of people who would benefit from that. Yeah.
And I think there's a lot of really good points and things that we can, in terms of sort of intersecting that world of mindfulness and yoga and how we can become more effective communicators through some of those practices, for sure. I mean, that's personally something that's huge for me. And I there's lots of ways to take that in terms of how to, implement that on a regular basis.
Well, awesome. Well, I'm going to summarize some of the amazing things you said today. We started off by talking about how all healthcare is delivered through relationships, and by effective communication, we can do a better job of delivering healthcare. We talked about one of the big pitfalls is the assumptions that we all walk into every interaction with, whether it's based on patient's characteristic, the diagnosis they're coming on with, and trying to step away from those assumptions. We talked about doing that through communication, and remembering that communication is a skill. These are things that we can work on, we can get better at, whether we think we're good at them or we know we're struggling. Either way, we can improve our communication skills. Some of the specific skills you talked about today: active listening, reflecting or calling out, identifying or naming emotions, feelings, whatever it may be. We talked about skills in clinical settings, setting an agenda with your patients, creating physical space to facilitate effective communication when you're delivering that, asking open-ended questions, and finally assessing their understanding with a teach back and what else until it's exhausted. We talked a little bit about tough conversations, how to check your emotions, and how we can, once again, control our interactions by doing that. And lastly, you said, doing this will make your life better. We struggle. All of us struggle at times in medicine or whatever profession you may be in, but being a more effective communicator, specifically in a field that is based on relationships, and that's why all of us go into medicine for one reason or another, this will make your life better. And I think that's such a strong message.
Yes, I do. I completely agree. Thank you so much for, giving me a platform to talk about these things, and tremendous thanks to ACH for sort of formalizing all of this for me, because this has been just like a personal journey for so long, and being able to actually be involved in a more formal setting has really been a great opportunity as well.
Awesome. Marissa, thanks. Have a wonderful day.
Thanks, you too.